Good morning, guys.
Good morning.
Good morning.
Morning. Hey, guys. Now, does anybody have any questions at this moment? Before we start, any questions about what we have done so far?
We left off yesterday with thrombos and embolas, I think.
Yeah, thrombosis or Then what did you say? We said
Embolus block.
thrombosis, thromboside, thrombolysis, thrombolytic. Thrombolytic is just going to be pertaining to thrombolysis.
Okay.
Okay, so you see a thromb, which is clot, lie, which comes from the word lysis, and just make it lytic. So when you say lytic, that's going to be pertaining to lysis. And what is lysis? Breakdown.
Lysis is breakdown.
Exactly. Okay. Lytic, anything that breaks down. Okay.
Thank you.
No problem, my dear. So what we'll be starting with today is going to be the suffixes. Okay. And what did we say the suffix was? That was mainly going to be as okay.
The ending of a
Or what comes after the root word. Okay, now please keep in mind, guys, the word comes after can also be replaced by follows. Okay, so whatever comes after the root word or whatever follows the root word. Both of those could be as okay how you would define what a suffix is. Okay. So we're just going to check them as okay as they come in the book. Okay, guys. Now the first one is L. Yeah, okay. Now this, along with a whole other bunch, is mainly going to mean pertaining to. To be more accurate, yes, okay, it says okay, pertaining to what? Yes, okay. Pretty much okay as what the root word is. Yeah, okay. Now there are going to be as okay other suffixes, which also as okay means pertaining to. Another one, for instance, okay, will be ik. We can also say as okay, el. will be another one. Okay. Airy would be another one. We can say it's okay. Egg will be another one. Okay, so what all these suffixes here mean is going to be pertaining to the food word. Did you guys get that?
Sorry, what was the fourth word? The fourth one after eel. After eel, what was that one?
ARY.
ARY.
Okay.
Thank you.
No problem. Okay. So let's just take a couple of terms and where we use is okay each of these. So that's okay. As we come to these terms here, we mean it's okay. We'll just we can say it's okay. Skip them because what the mean is okay. All we mean is pertaining to. So we can say if we use L as a root or as a suffix, an example could be renal. Okay, that doesn't mean it's okay. There's going to be okay. We can say pertaining to your kidney. Okay, when you use the word ran for kidney. We can even say neural. Okay, but again, pertaining to nerves. Okay, we can go on another one and say cerebral. Again, L pertaining to cerebral, which is in this case is going to be as okay, cerebrum or brain. Right. Did that make sense? We can see. Okay. Ileal. And okay, yes. What is this? Pertaining to. I hear this is going to be. Okay, so your ileum. Okay, which is going to, which we see is okay, going to be a part of your small intestine. We can
able to just just to spell that word. How did you spell it?
IL
Mm-hmm.
IEAL.
Okay, thank you.
No problem. What can we see next?
Yeah, I'm sorry. What's under that word that you just spelled?
ILEUM.
Okay. And that means what?
That's going to be a part of your small intestine. We'll talk about that in the next chapter there.
Oh, okay. Thank you.
Okay. You can say femoral. Okay. And where the L here is, just okay, yeah, sure. Pertaining to femur. Mainly it's okay, come from the word femur, which is thigh. Okay. So that's okay. Okay. We can say another one. Spinal. So again, or pertaining to, and here is okay. Spine. Okay. You can even go and say cervical. Again, L and cervix. No, that's okay. It comes from cervix, cervical, and that way is okay or mean. Neck. Did you guys get that?
I'm sorry, what does newel? What's the word under newel?
Palm it up.
I'm sorry?
What did you say there?
The word under newel, is that how you pronounce it? Newel?
Neural?
Yeah, what's the word under?
That's nerves.
Oh, sorry, thank you.
Okay. Okay. So the word nerve actually is okay. Sorry, means nerves. So neural will be pertaining to nerves. Okay. We can go on with with ick. Ick. An example, for instance, would be gastric. Ick is that's okay. The suffix that means pertaining to. Gaster. Is the word for stomach. Okay. We can say hepatic. So again, ick pertaining to hepat. Liver. Another one. Splenic. Pair. Pertaining to. That's okay. A structure that we call the spleen. Okay. We can say we did those yesterday, but we can still take it. Optic. Pertaining to eye. Otic again. Pertaining to ear. Did you guys get that? Right, okay. We can go on with this one here. Yellow. Now that's not that commonly used, just for a couple of words. You can say it's okay. Meningeal. Okay, but pertaining to, yes, okay. Or in this case, it will be mening, which is the meninges. Another one. Esophageal, which is going to be, yes, okay, pertaining to the esophagus. Did that make sense?
What does the first word says? The machingle, if that's what it says.
This one?
Right before esophageal.
It's esophagus.
Esophagus.
ESO, right?
Yeah, and
HAGUS.
the word before that one.
Meninges. MIN.
Uh-huh.
INGES.
Oh, okay. Thank you.
No problem. So maybe it's okay. I should go to another slide. We'll be running out of room here. Okay.
What does the meninges mean?
Okay, Justine. We'll talk about that one.
Okay,
Most likely on Monday.
okay.
Have you never heard of the meninges?
No.
Have you
No.
heard of something called meningitis?
Yes.
Oh,
No,
yeah,
okay.
yeah.
Okay. Now the meninges is going to be as okay, occurring that cause your brain and spinal cord. Okay. So a lot of your structures in the body is okay. They have these protective coverings. Okay. And the one that causes your brain and spinal cord goes under the name of meninges. Okay, yeah. But the details of that is okay. We'll talk about. Okay. I would like to say tomorrow, but I guess we don't have class tomorrow.
Thank you.
Okay. But right now, just okay. I appreciate it. Okay, as these are just always okay. The suffixes that all is okay mean the same pertaining to, but it's okay where we mean it's okay put specific it's okay suffixes to specific words. Okay, and why specific is okay because it eventually is again going to mean the same pertaining to this, pertaining to that. Okay, by why L, why not ik? Why EL and not Ari, so and so. So not only that, but it also has to look sound good. That's pretty much okay. Now we can say Ari. ARY means the same as okay pertaining to. So here we can say one example would be pulmonary. Okay. The area is okay, yes, pertaining to pulmon, which is lungs. Okay. Okay, let's see. We can say urinary. And again, it's okay, pertaining to, well, okay, yes, something about urine. Okay. Um, What's the next one? Egg. Now we can see cardiac. Okay. So that becomes pertaining to the heart. Okay. Okay. What else? Okay. R. Okay. I guess old age. It skipped my mind. Okay. That's fine. We'll come up with something once I come across. Okay, yes. Okay, guys. All these as okay meant the same. Pertaining to. Okay, so it's mainly going to just be says okay, pertaining to. That's okay, what become your root word. The two common ones that we see most of is al and ik. Okay, okay. So now let's just go on to our next term, and we can say, and you guys will realize it's okay. We used these terms here. So okay, we have already used these terms. Now what I just want to say here, anything that ends with ia just becomes a condition. Okay, so anything that ends with ia mainly mean that okay, the whole word is going to be as okay the name of a condition. Whereas okay, when we say algae is okay mean painful. Okay, so you can maybe say okay, anything that ends with the word algae is going to be as okay a painful condition. Okay. Now we did ought algae. Okay. Where ought was ear. And if we can say it's okay that algae, I mean it's okay, this was a painful condition. So it's okay what some people also commonly will call earache. Technically can be called autalgia.
So is algia the suffix?
Yeah.
Like, okay.
Okay. Okay. But it's okay, here it becomes condition mainly because okay, it ends with ia. Okay. Okay. Whereas we said algiac, then okay, yes, pertaining to pain. Did that make sense?
Yes.
So here is okay, there will be just what you call is okay, earache, whereas if you said Utalgic, that just become part, yes, okay, pertaining to ear pain. Did that make sense here? Where, okay, this becomes just okay. Algiac becomes your suffix. Okay. Well, yes, okay, the word algia is made up of two suffixes, if you want to put it that way, because it's okay, ear. And just a little bit, okay, we talk about ear, mainly it's okay, just means that, okay, any word that ends with ear will become as condition. Okay, but it's okay, if it is preceded by alg, which means painful, it becomes painful condition, by condition of pain. We can say it's okay, optalgia, which again is okay, this becomes, that's okay. A painful condition of eye. Okay. There's another term, guys. Neuralgia. Now here again, it's okay, the word algia just becomes, okay, a painful condition. Okay. Nerves. Okay. Now, guys, although most pains involve nerves, well, it's okay, it's being picked up by nerves. Okay. But there are going to be, it's okay, cases where it's okay, the pain itself is due to the nerve being affected. Okay. Have anybody ever suffered from a prolapsed disc? No, okay. But the reason that, okay, yes, the person has pain is because the nerve is trapped. So that kind of nerve will be neuralgic pain. Okay. Have any of you heard of, yes, okay, what they call shingles? Not the shingles on your roof. Okay. Okay. And now what happens is that, okay, the nerve is okay, that virus actually is okay, may attack the nerves. And that can lead to, yes, okay, some excruciating pain. So that pain as well will be an example of neuralgia, or what we can call it, and it's okay, neuralgia, okay, nerve pain. Okay, because it's the nerves themselves that are affected. Okay. We can go and say art. Algae. Okay, yes, okay. Algae still becomes a painful condition. It's okay of your joint or joints. Okay. Now there's a word that's okay, it's not mentioned in your book, but let's just bring it up. Let's take it to the next slide. That's fine. That's good. which is fibromyalgia. Now, guys, here is okay the word fiber or fiber. It's from fibrous tissue. O here, guys, is your combining vowel. The verb my actually is okay derived from myo, which was muscle. And algae is okay, just becomes just okay a painful condition. So what they mainly is okay thing, because this is not really a disease as such, it's more as okay a sort of phenomena, if you want to put it that way. Okay, but where the patient mainly is okay complain of generally is okay muscle and it's okay muscle and joint aches. Did that make sense? Okay, so they made up this term of this, okay, what they were called fibromyalgia, but this is pretty much okay as how it is made. Now you can say it's okay, both fiber here and my is okay. We can say it's okay, word B, root words. Clear? Okay, we are just following as okay by this suffix here. Okay, and what I said the other day that just okay, usually it's okay when we combine two root words, sorry. Okay, usually it's okay have a combining vowel in between them. Did you guys get that? Now another word that is probably not okay written in your book. Cephalgia. Now, okay, it's algia become yes, okay, a painful condition. What is ceph? What does the word ceph mean?
Head,
Huh?
head,
Head. So what can be as okay a fancy word for headache? Cephalgia. Okay. Now, please, okay, God forbid, yes, okay, if you wake up one morning with, okay, there's a severe migraine, and I can't take the class today, it's too much, and you send an email, don't send an email saying, Mac, I had the worst cephalgia of my life today. Okay. That's okay, you got a headache or whatever, okay?
I suffer from migraines, from chronic migraines, and I'm
Mm.
gonna start just saying that to people.
Yeah,
Papacephalgia.
okay. And there you go, okay, what, a new kind of, okay, yes, you don't see that kind of migraine in the textbooks. Okay, but yes, okay. So yes, okay. So anything is okay when it aches, that's okay, that becomes a painful condition. Right? Okay, so you can say arthalgia, earache, ophthalgia, eye ache, cephalgia, a headache, right? Or headache, things like that. Okay. And again, yes, okay, a word which is not written in your book. Now, maybe comments, okay, you may think this become a little bit too graphic, but okay. There's something called an analgesic. Where ick here Yes, okay, all yes, okay, pertaining to. And you may say, well, okay, then. Is this just okay, the painful condition? And anal would mean pertaining to anus. So if somebody is a pain in the ass, nah, because he is okay. This, sorry, okay. This become your pain. And here is okay, the and doesn't have anything to do with the anus or butt, but rather is a prefix which means no, none, or absence of. So analgesics is mainly as okay, just a fancy word for what you call painkillers. Because okay, what is it they do? They cause that you don't have any more pain. Okay, there you can say it's okay then. Analgesia would just be it's okay. A state of no pain. Did that make sense? So sometimes it's okay, you have to, it's okay. Watch out where you break up the words because its meaning can change drastically. Okay. So it's okay. If somebody is a pain in the butt, don't say, okay, you are an analgesia. No link together, okay? Okay. So yeah. Okay, guys. Let's just go on to the next one. Site. And we mainly said that site meant cell. Now, what cells are, yes, okay, we'll talk more about that in, okay, as your next chapter. And, okay, it's a detailed account about cells in anatomy of physiology. Okay, just so you gotta know, okay, as every living organism is going to be made up of cells. Okay, so when we say take site as a rule, that's okay, as a suffix, it means okay, it's going to be used to name the type of site cell that we talk about. So, okay, so site or cell is going to be okay, the basic unit of life. Okay, now we had a couple examples. I hope everybody will know what this one is. Erythrocyte was your red blood cells. Okay, we had leukocytes, which was your white blood cells. Yesterday, as okay, we ended our discussion by saying thrombocytes. Okay. Where we say, okay, mainly it's okay, the cell that's going to is okay. They don't really form the clot. The thrombocyte doesn't really form the clot, but they may, as okay, as we can say, the cell that's going to just initiate the whole clotting process. Okay, so that's pretty much why. Okay, we can say neurocyte just becomes nerve cells because nerve is nerve. O here is combined vowel, side becomes cell, so nerve cell. Okay, we can say myocyte, where myo just is muscle side cell, so that becomes a muscle cell. Okay, we can take another one. We can say, okay, hepatocyte. So liver, combine a vowel cell. So it becomes a liver cell. Right, okay. Another one is going to be melanocyte. So here, cyte is cell, melan. Mainly as okay, just the short for the substance called melanin, which is going to be as okay, the pigment. And then it's okay, O is your combining vowel. So melanin is going to be the name of the pigment substance. The cells where that substance is found is going to be called a melanocyte. Did you guys get that? Any questions, guys? What else can we see? Ectomy. Now, although it's okay, this it's by itself is one suffix, which is a whole meaning. It's okay, will just mean removal of. Okay, but as I have said, since we just okay used it earlier in it, chomi meant cutting into, and the word ek you and act as okay came from meaning as okay will mean out. So cutting out straight ahead, we can say okay that ectomy will just mean to cut out, and something which is cut out is going to be as okay removed. Now just think of things that you can remove out. Let's just start from the beginning. Adenoidectomy, removal of the adenoid. And do you guys recall what the adenoids were? Right. It's a gland in your lower nasal passage. We can then go on and say, yes, okay, what else could we remove? We could, yes, okay, say tonsil. Ectomy, we just will mean removal of tonsils. Okay. It may sound strange, but we may even have okay, something called ectomy. Okay, where okay, yes, is going to be removal of gaster, which is stomach. Now, usually that's okay, not the whole stomach, but even it's okay, even if they remove part of the stomach, it'll be called as okay, gastrectomy. Okay. And what we also can do is pulmonectomy. Which means okay, which just means okay, the removal of and pulmon, guys. Lung. Okay. So they may remove a whole lung. That happens. Okay. So the removal of a whole lung, either the right lung or the left lung, all depends upon us. Okay, which one is not viable. Okay, yes, that may be removed. So then some of you will say, okay, how is the person going to be breathe? How is the person going to be breathing? You still have one lung left. Clear. Okay, so things is okay that you have a pair of, well, okay, you can still always remove one and okay, the other one would just well, okay, be on a little bit it's okay overtime if you want to put it that way. Just have to do the job of two. Okay, so but if you choose not to remove the whole lung, well, okay, yes, you may come across as okay, it's going to be lobe or lob ectomy. Yeah, okay. Now here is okay, that's going to be is okay, removal of, and here is okay, the lob or lob actually is okay, derived from the word lobe. Yeah, okay. So yes, okay, removal of a lobe. Now that could mainly as okay be a lobe of your lung. Then they would just call it as okay, pulmonary lobectomy. Just to specify, okay, here when we talk about this lobectomy, it's going to be as okay, the lobe of a lung that is removed. Okay, they may as okay, of course, as okay, they may have to specify the site. And okay, as maybe as okay, which lobe within which lung is it that that was removed? Okay. Another case that's okay where a lobe may be removed is going to be as okay. Hepatic lobectomy. Where the mean is okay, may remove a lobe of the liver. But generally speaking, it's okay. Any organs, it's okay where we find lobes. Well, okay, yes, it may be possible to, it's okay, remove part of whole of that lobe. So that's going to be called lobectomy. Did you guys get that? We can say, okay, what else can be removed? Okay. Thyroid. Ectomy. So again, it's okay. We can say it's okay. Removal of the thyroid. Okay. We can go and say cholecystectomy. So mainly it's okay, removal of the gall bladder.
I'm sorry, that's CHS, or what, how do you spell the beginning of that word?
Well, CHO. CHOLE, chole, CYST, cyst.
Thank
And
you.
then ectomy. No problem. Okay. So CHOLE, chole, CH or CYST, cyst. And then you just follow it with ectomy. We can go and say nephrectomy. Just becomes just okay. Removal of nepher in this case, yes, okay, which is your kidney. We can say, do you guys mind if I go to another slide?
No, it's okay.
Appendicectomy. Okay. Which is just going to be removal of appendix. Yeah, okay, so please keep in mind, guys, okay, usually it's okay when we have a suffix, okay, we have a root word that ends with X, and it's going to be as okay followed by a suffix, that X is going to be as okay be replaced by a C. Did you guys get that? Okay. So it's not going to be as okay appendixectomy. It's going to be appendicectomy with a C. Although it's okay, the name of the structure is called the appendix with an X. Okay. What else can we remove? Okay. Now it may sound a little extreme. Colonectomy. Okay. Now usually it's okay when they say colonectomy, it's okay. You can say that will be as okay removal of it's okay what we call the colon. Okay. Now guys, and that's where we can say it's okay, there may be. You can say it's okay, it may be partial. Okay. But you may come across a word that will be as okay. And you can say it's okay, hemicolonectomy. But the word hemi means okay, will just mean half. So removal of half of the colon. Okay, guys. If the entire colon is removed, if the entire colon is removed, and what happened is that okay, yes, they may even yes okay remove what's left after the colon, which is the rectum and the anal canal. That kind of colonectomy is going to be called a pancolonectomy. Okay, so they pretty much okay as well close the butthole. So the entire colon being removed, that's going to be called a pancolonectomy. That's a major plus surgery. Like, okay, that procedure takes up to 4 or 5 hours because there has to be 2 surgeons operating, one on each side, one from the abdomen and one from from down the pelvis. And ultimately, it's okay, and they have to coordinate. Okay, now we're going this way from the top. Now we're going from the bottom. And they actually have to make a handshake. Okay, not handshake, and not shaking hands in the patient's pelvis, but like okay, they were actually like okay, ends meet. So now out of the 4 or 5 years where I've been working in as departments with abdominal or what you could call it general surgery, I have only seen one pancolonectomy. So it's probably not something that you guys will come across or hear of. Extremely rare. Okay. So nowadays that's okay if they want to, it's okay, even if they can preserve as 4 or 5 inches of colon, there's something will be better than that. But it's okay. I still remember that. So, okay, there's something that they call a pancolonectomy where the whole thing You still have your small intestine, you still have your stomach. Not okay, nothing has been done to that, but they mean it's okay, we just remove it, okay, all those other organs or structures. We can say it's okay, something else can be removed. So that's going to be as okay. Removal of the prostate. Yeah, okay. You can stay in the male. Let's just go to the female. And we can say there's something that they call is okay, an OO. Rectomy, which means it's okay, going to be removal of the ovaries. Yeah. Now, although it's okay, we don't actually, it's okay, remove anything. And okay, the next two words. But it's okay, they still just mean it's okay. They still apply as okay, the word ectomy to it. One is going to be as okay, what we call a vasectomy. Now here, nothing is actually being removed. So we can actually, it's okay, just say, okay, they had the word, that's okay. Ectomy means it's okay, ligation of. Oh, it's okay, the word vas. Now, generally speaking, it's okay, the word vas means it's okay, we mean vessel. Now, does anybody know what a vessel is?
Like a blood vessel,
Okay,
something that holds something.
okay.
Is a vessel like an empty like area? Like
Okay. Okay, just need them. There may be a lot of empty areas, but you can't call all of them vessels.
it's a special empty area.
Okay. Special in what sense?
I'm not sure.
Not sure. Okay. So you don't know what the special thing is. Anybody? Now, Brian, when you say blood vessel, you just call it a blood vessel because it carries blood, right?
It's like a tube that circulates blood.
That's what I was
Tube, there
thinking
you
of.
go. So any tubular structure can be referred to as a
Vessel.
vessel or vas.
That's what I was kind of thinking of, but the first thing that came to my mind was a blood vessel.
Okay, that's okay.
Which just makes sense.
Thank you, Michelle.
So a tubular passage can be referred to as vas. Okay, but okay, guy, here it's okay. This is not a blood vessel. Okay, this actually is okay. This vas here actually is going to be derived from the word what we call vas deferens, which is made as okay a tube that well okay yes will carry the sperms from the balls or from the testes. Okay, and actually it's okay. Don't remove that. You just have okay the vas deferens, and what they mean is, okay, we just do is apply two staples, and in between, burn it. But that's mean is, okay, how they pretty much, okay, as block the vas deferens, and okay, as any sperms coming from here is okay, can't move ahead because the road is blocked.
Wait, so they burn the tubes?
Burn it, yes, okay. Not burn it like, okay, with a match, or there's something that we call a cautery.
Right,
It's
but it's
really cuts and stops the bleeding at the same time.
but a vasectomy is reversible, no?
Huh?
A vasectomy is reversible?
Let's not go into that. Because sometimes that's okay, it may not be. Well, okay, the dude may think that, okay, he is sterile, and before you know, he's calling to the Maury show because please be with that. But like, okay, so that's okay. I remember, okay, I don't know what was going on with the men in that area. But usually that's okay. Every Friday would be as okay vasectomy day. So we had this outpatient, because it's not really something that you have to get admitted for. You come in, okay, as not you, but Singa. The the guy will come in, and okay, as they have signed a waiver, or it's okay, you can say, okay, well, I'm doing this on my own free will, so on, so on, so. But that's okay. They went for it, and then we say, okay, come back. And then we'll give them a cup and say, okay, come back in a week with okay, yes, with a semen specimen, and we'll check it. It's okay, yes, if we found any, why, but it's pretty much okay, as done within 10 minutes. The procedure, skin to skin. So burn it is okay, mainly it's okay with a cautery, it's okay, which is a tool that mainly it's okay. You can use it to cut with, and okay, what it does at the same time also, it's okay, stops the bleeding. So that you don't have to be standing there, okay, yes. Keep on pressing, or compressing to stop the bleeding. Okay. But it's okay. Here they don't be physically, it's okay, physically nothing is being removed. Okay, but they still just call it as okay, vasectomy. But that's what they call it in the women. Or in the men, sorry. Because it's going to be the men that, okay, is that we have the vas deferens, which is mean is okay, just between the testes and what becomes the spermatic cord. Now, guys, in the women, okay, that's what they call ectomy. So again, as okay here, the ectomy is not really as okay removing, but rather just a ligation. Ligation of what? Yes, okay, the selfings, which is what you can call, yes, okay, the ovarian tube.
I have a question about that. So the procedure then would be the tubal ligation, and that's completely because this is the removal of, but the tubal ligation would be the procedure. Is that right?
Yeah.
Okay.
So a technical word for what you call as okay, a tubal ligation is selfingectomy.
It's the same thing.
It's the same thing because, my dear, okay, they don't remove the ovarian tube. What they mean is okay, just say you have the ovarian tube. You guys says, okay, going to the uterus. Over here, so, okay, you have the ovaries. So what the mean is, okay, we just do is the same that if we do it in a vasectomy. Staple, staple. But
Okay.
so even as, okay, if the woman is ovulating, the ovaries can't make its way to the uterus because the road is blocked. Did that make sense? But this means is, okay, we're just in simple words, we'll call it, okay, a tubal ligation. All this, okay, we had our ectomy in it, but nothing actually is being removed. Did you get that, my dear? Okay, guys, something else that can be removed. Thrombectomy. Now, that's going to be, okay, removal of, and here's, okay, that's going to be, okay, the physical removal of a thrombus. Now, what was a thrombus? A blood clot. Clear, okay. Usually it's okay, they may do that in the carotids. May just, okay, restore the blood supply to the brain. Okay, people may have, okay, so blocked carotids that, okay, as the blood supply to the brain is, you can say, okay, dangerously low. Okay, so as, okay, they may go with for as, okay, for a thrombectomy. Okay, but here is, okay, you physically is, okay, remove the clot. Okay. Even as, okay, most of the instance that I've seen is, okay, as in the legs. Mainly because, okay, some parties toe stars turn blue. So mainly as, okay, just to restore the blood supply is, okay. It mainly as, okay, do those block due to as, okay, a clot that has blocked the artery. You actually is, okay, snake it out. So you may say, so you went to med school to become a plumber? No, okay, but that's pretty much, okay, how it works. If you see it's, okay, how you snake out a drain or something like that, the same thing, the same mechanism. Now, we don't use a Home Depot snake to do that, but okay, yes. Okay, but ultimately it's okay, it's okay, just pull it out. Okay. So you have that blood clot there. But that's only going to just, okay, work in acute phases. If your toe already is dead and they evaluate that, okay, as it can be revived, then it's better not to touch it. Right? So don't, in God forbid, 20, 30, 40 years from now say, my teacher once told us, told me that, okay, yes, a blood clot can be removed. So and so, yes, okay. It's not a procedure that's free of risk. But it's okay, in 34 years from now, maybe it's okay, the methods have improved, maybe they have, probably it's okay, there may be better tools available on the shelf that can be used. Okay, so okay, guys. Now just last two terms, then okay, yes, be done with the removals. And I will make yes, okay, just do it and say yes, okay. It's going to be. Let's do this one. Hysterectomy. Okay, but this was because it's okay. The removal of the uterus. Okay, guys. Now, okay, I think on the previous page we did oophorectomy, the removal of the ovaries. Now, does anybody know what is the male equivalent to the ovaries? If women have ovaries, what does the men have?
Testes?
Huh?
Testes? Testicles?
Testes. Okay, good. What's another word for testes?
Testicles?
Okay. Testicle just mean pertaining to the testes.
Um,
Isn't that what some people call it?
yeah, I just.
Okay,
thinking of
so
the
the
word.
word that's going to be as
I was going to
okay.
say balls. I didn't know is that if that's what you meant.
Okay. So is that going to be a term called as okay, ballectomy? Nah. When we say it's okay, removal of the testes. And that's why it's okay, guys. It may be as okay, a little bit sexist, but orchidectomy. Test your testicles. And some of you say, well, okay, isn't this a name of a flower? Now, guys, do you guys know where the word testes come into the picture then? They named it after a flower. Okay, testes is orchids. Where did the word testi come in? No
Because of-
idea?
Because of the way that they're shaped, like the flower somehow.
Not really. They're not shaped like the flower, but
Or like the tubers. I don't know. Okay.
well, my question is, okay, they named the testes after the flower. Okay, but then where does the word testi come in? Why do they also call them the testes? Okay, guys, have any of you ever been called to court? Not for that crazy thing where you sit and say nothing, do nothing but just listen, not jury duty. I'm not talking about that. But where you had to come in and you've been a witness of something, and what if you're a witness of something, what they're going to come in to be?
I'm gonna testify.
you would testify. Now, nowadays, that's okay. Even ladies or girls or women are allowed to testify. Back in the days, that was not the case. Because what was it that the people who testified are going to testify on? Their testes. They swore on their testes. And that's why it's okay to testify was called testify, because they would testify on their testes. And that's how they kept the women out. Right? Okay, that's how women were kept out, because they say, well, do you have the testes? Do you have the balls? No, I don't. Then okay, okay, then you can't testify. It may sound sick, but it's okay, guys. That's how it used to be. So it's okay. When did the women get the right to vote here? Because before that, it was only men who could vote. And even in the beginning, yes, okay, you have to be, yes, okay, of a certain class to be able to vote. Wasn't that in the 1920s? So for approximately, yes, okay, 200 and some years, that's okay, women were not allowed to vote. Now you guys are allowed to, yes, okay, even testify, right? Okay. But the word is still testify. So, yeah. So there are some crazy stories out there. Okay, guys. And another thing you want to remove. Nope. So pretty much okay, as you can see, it's okay. And the top of my head, yes, okay, this is what will be, okay. So in this case, yes, okay, it's the so let's take a short break. Should we say that I see you guys back in around 10:40? Is that fair enough? Okay, guys. Have fun till then. Okay, guys. Welcome back. So any questions yet? Nope. Now our next term is EMEA. Okay. Now you can say EMEA. Now since it ends with EA, becomes a condition. If you, for instance, said emic, or even emic. Becomes pertaining to the condition. Where here is okay, the word em, em refer to blood. So pretty much okay, we can say that emia is going to be as okay condition of the blood. Did you guys get that? Yep. And anybody who suffer from okay, arterial blood condition is going to be okay, emic or emic. Let's take an example. Now we have already said Luke. Oops. Oh, did it? Okay. Emia. So because it ends with E, this becomes okay a condition of the blood. And in this case, this way is going to okay affect all white blood cells. But the word itself, leukemia, is a blood condition. Now it's just a matter of okay, as what does it mean? As I say, it's a utility, it's okay, was a form of blood cancer, it's okay, involving your white blood cells. Okay. Where we say okay, as a extreme high count of cancerous white blood cells. That's what we call leukemia. But once you see that, okay, yes, it ends with ema, it's a condition, it's okay, having something to do with your blood. Did you guys get that? Now another example, guys. And most of you, okay, may have heard that a lot.
Sorry, so would leukemic mean referring to the white blood cell?
No, leukemic would
Or
then be
pertaining
as
to-
okay. You say it's okay, leukemia is the condition. Whereas you say leukemic, that's going to be the patient who suffers from leukemia. He or she is going to be leukemic.
Okay.
Did that make sense?
Yeah.
Okay.
Thanks.
No problem. Again, yes, okay, E becomes yes, okay, the condition of blood. And if I just put this prefix in front of it, now this prefix here actually is okay, means no, non, or we can say it's okay, the absence of. A condition in which there is absence of blood. That's what the word anemia means. Although it's okay, term-wise, it's okay, we know, well, okay, yes, if you have no blood, or there's a complete absence of blood, okay, forget about being anemic or not anemic, you be dead. Okay, okay. But that's okay. I guess okay, back in the days, okay, they could only as okay call somebody anemic when they say okay, as it looks like okay, he or she has no blood in him or her. Great. Nowadays, we just will know that okay, as what's going to be anemia. Well, okay, that's just going to be as okay, a low primary as okay, your red blood cell count. Is going to be as okay, you call that anemia. Okay, so the term means one thing, the word means something else. If you go word by word by word, or prefix, root, suffix, malakayas, it would have meant no blood, or a condition where there's complete absence of blood. Where okay, the term actually means okay, as a condition where okay, there's a low red blood cell count. Okay. Not necessarily always low red blood cell count. You may have a normal red blood cell count, but even it's okay if there is a low iron in the blood. Like the person is low in iron, it also be as okay referred to as anemia. Now, a person who suffers from anemia, he or she is going to be anemic. Did that make sense? So anemia is the condition pertaining to anemia, or in no scholars says, okay, that's going to be the patient. He or she is going to be anemic if he or she suffer from anemia. Did you guys get that? So you may look at the word anemia, let's say, from a different angle now. Okay. So this means okay how it is. Yes, okay. Made up together. Now, guys, usually it's okay when we talk about things, we can say, it's okay, what's going to be the opposite of anemia? But we mean it's okay, we'll say it's okay if the person had a low red blood cell count, it's okay, he or she means it's okay, will be characterized to be as anemic. But what if, okay, the opposite of that would just be, if that was okay as a greater than normal count of your red blood cells, that your blood actually has more than normal red blood cells. Here we go. We're going to make up this word and okay, look at each component. But if you look at it, it's going to be okay. It's going to end up with M E, which as a whole means you can say okay, that will be as okay, blood condition. A condition is okay related to the blood. But we will have a word which is going to be poly. P-O-L-Y. Okay. Now poly can mean two things. It can mainly mean many or much. Okay. And the next word in between here is going to be site. which is sun. But in this case, yes, okay, what they mainly is okay talk about is going to be yes, okay, your red blood cells. So what is going to be polycythemia? Yes, okay, where you mainly have many. Yes, okay. Red blood cells. Or the condition where your red blood cell count is too high. Or you can say the opposite of anemia. Okay. So the word poly, P-O-L-Y, means many or much or a lot. Let's do this. Many and a lot. That's what it can mean. Cyte, C-Y-T, comes from the word C-Y-T-E, which is cells. M is blood. E, condition. So polycythemia. Did you guys get that? That's the opposite of anemia. Good. Now, does anybody know where polycythemia would be normal? There are places in the world where it's okay, the people living there will have a higher red blood cells than other people. What areas could those be? No clue?
Would it be like cold climate places?
Nah, not necessarily, dear. A good guess. You can say, okay, those areas are going to be colder or it's okay, colder than other places, but it's not due to the cold weather. It's due to something else.
Somewhere with like high peaks, like
High
Colorado.
altitudes, exactly. High altitude. So people who lives in the high up in the mountain ranges and things like that. And why is that? Because at those high levels, the air is low in oxygen. So pretty much okay to fulfill your body's need of oxygen. The body may says, okay, you will produce more red blood cells because their primary job is to transport oxygen to the cells and tissues in your body. So your tissues doesn't get enough oxygen, it will signal. It's all chemistry, guys. Okay, and your bone marrow, as a result of that, is okay, will produce more red blood cells. So that's okay. People who live in it's okay by what you call her Mount Everest and all those. Okay, they're not going to have okay as a better stamina just because they're used to climb those mountains. They are used to do that without it's okay running short of air because just okay they have a higher red blood cell level than okay somebody like us flying in directly from Connecticut. We don't really have any tall mountains here, right? Okay. Most of the towns here are at sea level. But that doesn't mean that, okay, just because we are right next to the ocean. Okay, you walk and you see the white ocean level right there. Right? Okay. So, does anybody know the tallest mountain in the world? Nobody know the name of that one?
Is it Mount Everest?
Mount Everest. Okay, my dear. And where in the blue is that? Okay. Never heard of Mount Everest?
Yes.
Okay,
Is
good.
it
So where is she? Where is she?
Southern Asia or something like that?
Yeah, if you want to put it that way.
It's by Nepal.
Yeah,
It's in
China.
Nepal.
Thank you.
Okay. What's the runner-up to Mount Everest? And let me just tell you, yes, okay, she may be not as high as Mount Everest, but has never been topped.
Is it Aconcagua, something like that?
No,
No? Okay.
it has a very basic name.
K2.
Huh?
K2.
K2. And Hifsa, where is K2?
Also in China.
Nope,
Is it in Pakistan?
it's in Pakistan.
Uh,
So that's okay. That's where you mean, yes, okay, some of those mountain ranges, that's where you'll find some of the, okay, pretty much, okay, 8 out of the 10 tallest peaks or mountains in the world is found in those mountain ranges. Good. So, but I think there's a movie about K2, right? Yeah. So, yes, okay, although not as tall as what's her name, Mount Everest, but hasn't been topped yet. So that's okay. Nobody has reached or be able to climb to her top yet. So because she goes like this at the end. Okay, guys. So EMEA, you can go on. Okay. Now there may be as okay terms that ends with EMEA, which are not necessarily as okay blood conditions, but we can say, we can just say it's okay, end with EMEA, right? And we will go and say like that glyc here is okay, is mainly is okay, what we can call sugar, or to be more accurate, glucose. And then we may go and say hyper, where hyper will be, we can say it's okay, above normal. So hyperglycemia, pretty much okay, is where the person has a higher than normal glucose level in the blood. Okay, we can say it's okay. The opposite of that would just have been hypoglycemia, which would just have been a lower level of glucose in the blood, a level which is below the normal. Okay, there's a term which is your, and we can say it's okay, emia. Now, what does be? I mean, it's like it's a condition of the blood, or a condition that's okay involving the blood. And if you look at the word "ure" here, it smells like urine. But here's okay, the word "ure" actually is okay, is referring to a substance called urea. A substance that's going to be as okay secreted in the urine. But when we say uremia, that's going to mainly as okay mean that we have a high level of urea. It's okay in the blood. Or a condition in which it's okay, there's a high level of urea in the blood.
So urea just means high level?
No,
Oh,
this is a substance, my dear. Just like glucose is a substance. Did you guys get that? Okay. So here it's okay, urea actually comes from urea. Now what is urea? It's a base product derived from the breakdown of proteins. Okay, so certain proteins in the body is okay when they're broken down to do yes, okay, to perform certain actions and so activities of the body. The waste product will be urea. Clear? Okay. Okay. So that urea, the level of urea is okay, high in the blood. That's what we'll call uremia. Clear? Okay. Because ideally, is okay, this urea should be excreted out in the urine. Did that make sense? Did you guys get that? Okay. We can increase a lot of things in the blood or decrease. Okay, or we can just put it this way. Forget about increase or decrease. We can just say it's okay. Lipid emia. That's okay. When we say lipid, yes, okay, that's going to be as okay condition involved in the blood where there's fat. Right. So a little lame term for as okay, high cholesterol or something like that. Maybe it's okay, lipidemia. Or if you want to say specifically says okay, higher than normal. Well, okay, we can say it's okay, hyperlipidemia. Okay. But once you say lipidemia, it's okay, it's understood that okay, as presence of lipids or fats in the blood. Okay. Anything that okay, as ends with emia is a condition that involves the blood. Did you guys get that? Any questions, guys? Nope.
So far, so good, I think. Gram. Now gram is going to be as okay, the record.
If we say Grammy, it becomes the recording. And when we say the recording, yes, okay, that becomes the procedure to record. Is that clear? Okay. In some cases, okay, the word gram or graph or graphy will also, it's okay, be the same. Record, but usually it's okay when we say graph, it is either something that goes like this, like a regular graph. Okay. Or what you guys may have sound off for. Sonography. Okay. So it's okay here, the word graph kind of mean it's okay recording like a graph like this, or even it's okay image. Even it's okay if you look at a graph, physically it's okay going up and down like this. It's something that you visualize. Okay, where here it's okay, the word son comes from the word or means sound. O is just okay, yes, you're combining vowel. Okay. So mainly because it's okay, we use a sound to, in this case, it's okay, create a, not a graph, but actually it's okay, an image. That's why they call it sonography. Yeah. Right. We can even go and say it's okay. Echo. RD. O. Graphy. Yeah, this just becomes just okay now. Procedure. Whereas the echocardiograph becomes the actual image of what is okay, you see the heart. Okay, but why do they use the word echo? Yeah. Okay. Called echo is, what's an echo?
A sound?
Okay. So me speaking now, is that going to be an echo?
Yeah,
No.
No. no.
It's only going to be an echo when my sound
Projects.
Bounces back.
comes back to me, right? That makes sense, dear. Okay, so that's why I said, yes, okay, please mute your systems. So that, because when your speakers are on, what's going to happen? My own sound is going to come back to me. So I can actually, as I will say, I can hear my own echo. Did you guys get that? Okay, but whether you're scanning the heart in form of an echocardiograph, whether you're going to be scanning the liver, the spleen, the kidneys, the uterus, the baby within the uterus, all those things. Okay, what you get back, which is going to just, okay, produce your image, is still going to be an echo. but they just only use the word echo, yes, okay, when naming, yes, okay, the ultrasound examination of the heart. Okay, but the technology is the same. You send a sound, and some of that sound reflect back. And it's going to be that reflected sound that will produce your image. How and why? Yes, okay, that's what we will talk more about when we talk the physics of ultrasound. Okay, guys. So if I say, hello, how are you? And I hear my same voice going, hello, how are you? Hello, how are you? Hello, how are you? Hello. That's an echo. If somebody is okay, answer and say, I'm good, what about you? That's not an echo. But if you then end up okay, hearing is okay, I'm good, how about you? How about you? How are you? Then that's going to be as okay, you hearing your own echo. Did that make sense? It's mainly as okay, your sound that reflects back to you. So that reflected sound is what you call an echo. But generally, it's okay for all as we call sonography because you use sound to create an image. Did you guys get that? Good. What other ways is it that we can, or what other things is it that we can use to create an image or a picture? Please don't say camera. I'm not talking about those.
An
Electro.
X-ray?
Huh? Somebody said something.
I was gonna say electrocardiogram, EKG, electrocardiogram, or right?
Yeah. Okay. Good. Yeah. So what did we get in that case? A recording of the electrical signals in the heart. Okay. What I'm all talking about is okay, images where we can see a structure. There's actually yes, okay, something that well, okay, yes. Oh shit. It's called radiograph. Yeah, okay. All you can say is okay. Radiography, and this has become as okay, the procedure of producing a radiograph, which is okay, where here this is going to be as okay, physically is okay, an image. Okay. But what we use in this image here is not going to be sound. And it's not going to be as okay, the radio in your car. Here, this radio is mainly as okay from primarily as okay X-rays, or right now we can say it's okay anything which is radiations. Okay. So even as okay things such as a CAT scan, as people may call it, is a radiation. Okay. I personally don't like the word CAT scan because that things of okay that makes me think of an animal. Okay. And the CAT isn't enough. That's guys, okay, there's actually is okay something which is also called a PET scan. So not only being scanned by a CAT, but it's okay being scanned by pets. Have fun going to Petco. Okay, now PET is okay, not the PET, but actually it's okay, will be its name is okay, going to just be sorry. Okay, yes, an abbreviation. Okay, where the P stands for positron. P-O-I-S-T-R-O-N. Positron. E stands for emission. And T tomography. I mean, you can say it's okay. Again, here it's okay. We have the word graphy, which means it's okay or mean that we get an image. So we can say it's okay, or we have the actual picture is going to be as okay, positron emission tomograph. Whereas the process of recording is going to be as okay, a positron emission tomography. Okay, and when you look at the word tomography, there's always going to be something new. Tomograph, let's just put it this way. Because it's okay, here the graph would be, in this case, it's okay, because it's okay, the image. O is okay, our favorite combining vowel. And the word tom. Now, this is not Tom. This is tom. Which means it's okay, came from the word chomi, which meant cutting into. Okay. So whether it's a CAT scan, whether it is a PET scan, you get an image that maybe as okay, may appear as if you had cut into the patient and looked at him or her in slices. Did that make sense? So
Yeah.
Tom is not, oh, yes, okay. Sorry, somebody was saying something? Thumbs up or down? Or just maybe,
Oh, wait, just so I understand,
go ahead,
Tomo
Nadia.
is, oh, just so I understand, Tomo is cutting into? Or
Into.
Okay, gotcha.
Okay.
Thank you.
Great. Great. But here is okay. Now that doesn't mean that okay, as once they as okay, make you go under as okay, or as okay, that test performed that they actually slice you into slices. But actually it's okay, we'll see it's going to produce images as okay as you slice the patient and look at that area that you're sliced into. So you actually as okay, get series of images like that. Okay, we'll talk more about yes, okay, those kind of scans and so on, so on, so whenever it's okay, they may be used in the next chapter. Okay, but if you just look at the word tomography, tom is from tomi, which meant cutting into. Okay, now here they made us okay, took off the Y. They took off the Y here because okay, yes, okay, may put that Y over here because that's going to say okay, we have end up with okay, a whole new word. Okay. I replaced it with okay, a combined vowel between chom, coming from chomi, and graphy, which is going to be recording or record, in this case specifically as okay, image. Okay. But the reason that they call it tomography is going to be called as okay, you get an image as okay, as You say, well, okay, there was a person. And we say, okay, we might mean is okay. Let's do it this way. In tomography, it's going to be all like this. Sorry. So this is arm. I guess that's okay. This is one leg. As you mean is okay. Just well, okay. If you cut him like this. And then you just get, okay, yes. What does the slice look like here? This level here, so okay, you get a complete image. What is it that he or she is going to look like at this point here? That's going to be, it's okay, another image. Another picture. So actually, it's okay, end up getting, I'm just going to be running out of space, but we see this, sorry, this one here. You will get, okay, it's another picture. Okay, what is it that it's going to look like at this level here? So okay, that would be another picture. What will it look like here? Is okay, another picture. What is it going to look like? Let's see. And this level here is okay, another picture. And that's how you mean it's okay, we'll get that. Now those days are gone when it's okay, they print out those things. Nowadays, all these images are going to be stored on a digital media. Okay. We can mean it's okay, just say it's okay, you get this series of pictures at different levels. Pretty much okay, yes. Side by side like this. If you want to look at it like that, or look at it like that, or even yes, okay, if you want to see, well, okay, yes. A film. Here, from here to here to here to here to here, or here to here to here, like this.
So is it basically like how you like a technique of how you take the imaging?
Yep.
Okay.
But here it's okay, this they most likely will put you through as okay, one of those big donors, right? Or it looks like a donut. Okay. But the kind of imaging that you see is okay, it's okay, just as you have sliced the patient. What is he or she going to look at? Meaning is okay from top to toe at this level here. Okay. So back in the day, there used to be okay, big films with small font frames in them. Nowadays, they don't print those out anymore. Everything is digital. So stored on the computer. So you can pretty much okay run through yes, okay, those images, and okay, you can even play it as a movie. Movie, not okay as not the Titanic or anything, but actually just see it as a movie, just going through. Did that make any sense? Next word is ia. Now, is there anybody who is in the least amount of doubt what ia means? Ia will plain be condition. Okay, so any word that ends with ia will be a condition. You say ik or iek is going to be pertaining to that condition. Okay, we earlier said neuralgia, neuralgic, anemia, anemic. Clear, okay. Leukemia, leukemic. Right, okay. Fibromyalgia, fibromyalgic. Did that make any sense? So when it ends with "ia," there's no doubt about it that that is going to be a condition. Now let's just take two words that means the same or can be related to the same condition, but where we use two different words. And then we can always say, okay, when do we use one over the other? But both of them are going to end with "ia." So both of these here, okay, will have something to do with fever. Now, why do we call it pyrexia? Now, guys, what usually happens when you are having a fever?
Your temperature rises.
And when your temperature rises, what happens? Go ahead here. Take it to the next level.
Your body tries to cool down.
Okay, no, not that level yet. How do you feel?
Not good.
Okay,
Okay.
besides that.
Sweating,
Yeah.
shivering,
Fever.
body aches.
Body's trying to fight an infection.
You feel weak.
What did you say, Asma?
Do you feel weak?
Okay. You said everything. You guys said everything, but not
Your heart rate increases.
okay.
I said hot.
Did you?
Yeah.
Okay, sorry. Yeah, I guess you were. Your sound was okay. Yes. Filter
Okay.
out, but okay, that's okay.
It's okay.
But you feel hot, right? Or you yes, okay. Somebody in your household may is okay complaining that okay, yes, I'm not feeling well. And the first thing that most people would do, oh yes, okay, you feel hot. Clear. Okay. Now here's okay, the word pyre doesn't mean hot. Pyre actually means you guys don't know what pyre means? Fire. So back in the day, that's okay. Why would they? Yes, okay. What we now call pyrexia, which we just can refer to as fever. Because okay, when you have a fever, you're hot. Clear? Okay. So the mainly as okay, we'll just use it when because okay, he is hot like fire. Did that make sense? That's where the word comes from. Okay. But nowadays, it's okay, we don't say it's okay. So this is going to as okay be referred to fever, but mainly it's okay because as hard as fire. Where the word febrile actually is just okay, yes, the word for fever. Or technical word for fever. So a condition of fever is going to be fibrilia.
Is that
Does
a
that make
P or a T?
Yep. Yep.
Is that a P or a T? Oh, it's hot fever? No, the word on the bottom, hot fever, is that what you wrote?
No. That's what the word Pyrex would mean. Not really, but it means fire.
Thank you.
Literally, guys, the word Pyrex or pyre means fire. Have anybody heard of, just a second, Maria, have anybody heard of, okay, somebody known as being a pyroman?
Pyromaniac.
Yeah, what are those?
They love to start. They love fire. They play with
Exactly. People who likes to
set
set
fires.
on fires, right? Okay. So where did that come from? Pyre came from fire. And then just mania because they are cuckoo. Okay, Justine, you want to say something there?
Yeah, I was just gonna say, because I know you said if there's a root word that ends in X, then you can change it to a C.
No, but
Is
here
it
is
not in
okay.
that case?
No. Here, no. Here it's going to be pyrexia.
Okay,
Okay.
thanks.
So here is okay, my dear. The word actually is pyre, Pyre. But then we just okay, as you can say, smuggle in an X. So it becomes pyrexia. Okay. So pyre means fire. And why would they use that? Mainly because, okay, back in the day, they didn't know what was going on, but they could say, okay, this patient is hard like he or she is on fire. Okay. Where the word febrile actually is okay, will mean, as means, okay, just a more technical term for fever. So any condition or state of fever is going to be as okay, fibrilia. Did that make sense?
So for Pyrex, what would it end up being, a condition of fire?
No, why would it be a condition of fire? It would be a
Of
condition of
fever
fever.
still?
Yeah.
Okay, because
My dear, I said literally the verb pyre means fire.
okay, but both of those are just different words for fever. So
Yeah,
they're both a
yes,
condition of
exactly.
fever.
Exactly. That's why I said okay, at the end, both of these words, yes, okay, refers to fever.
Okay, thanks.
Right? Now, do any of you have Tylenol at your home? Now, what does it say on the Tylenol? Oops. On the bottle of Tylenol. It may say anti, fire, tick. Where tick here is mean it's not going to say okay, pertaining to. Yeah, it's okay, although it's okay, this is fire, but actually it's okay, to be more accurate, it's okay, it will be fever. An anti, okay, as mean it's okay, something that works against pyrexia or fever. Okay, but if you don't, if you want to replace the word higher out with febrile, then it's just going to be as okay. Anti febrile. Ick.
I have a question.
Yo.
Is febrile, is that more commonly used? Because I've heard
Yeah.
it before, like with children, like
Yeah.
having seizures, but I never heard pyrexia before.
No, okay. Yeah, you can put it that way. It's more commonly used. Okay. Or you can say it's okay. The word febrile is more as okay for fever specifically. Okay. But it would not be incorrect to say it's okay that the person also has pyrexia, which is okay, he is hot, but why would he or she be hot? Mainly because okay, she has a fever. So two words, yes, okay, we just mean that it's okay. Comes out to have yes, okay, the same meaning, but just using two different words. But as you say, it's okay, the word febrile or febrile is, you can say it's okay. Actually, it's okay, just a term that just directly means fever. Yeah. Any questions? So you guys clear on this? Itis, any question about the itis? Itis. I think we have mentioned quite a bigger or smaller list of itises, right? Okay. Good. Logi. Okay. Now, guys, it's not always going to be that, okay, as a specialty of medicine is going to end with logi. Okay. We may use, for instance, okay, logi for us. Okay, let's just say a couple. We can say as we said yesterday, yes, okay. Pathology, endocrinology. What else can we say? Cardiology. So neurology, sorry. Nephrology. Gastrology. Hepatology. Hematology. Physiology, not psychology, physiology. And what else can we say? Urology. Gynecology. Now you guys may avoid the E. I'm just used to it because that's how we have been used to. It's okay, write it. Okay. What else can we say? ophthalmology. Okay, we may need a little room for this one here. Ortho, rhino, laryngology. This is actually okay what they also call ENT. Ortho is ear, rhine is nose, and larynx is throat. Okay, what else can we say? Okay, something called rheumatology. But then we also have, okay, some, and okay, as for these, the specialist is going to, is okay, that the lodge is going to be represented by lodgist. Did that make sense? So lodge will be as okay, the person who studies it is going to be a lodgist. But there's also okay some specialties that ends with iatric. And in this case, here we can say, okay, what would those be? Psychiatric. Pediatrics. Right. And help me, Lord, there's even something called podiatrics. Now, pediatrics is for children. Just think of your pediatrician. Now you are Baraka, yes. It's pediatrician. Podiatrics is mainly okay from pod, which is now your iPods. Or means foot. So a foot doctor, he or she is going to be called a podiatrician. Then, okay, the opposite of pediatrics is geriatric, which is for senior citizens. Nowadays, okay, this thing has more in bariatric, right? Weight loss. Okay. All those is okay. Gastric bypasses or stomach reduction or whatever. Hey guys. What else do we have? Okay, I forgot the favorite one. dermatology. Okay, so even these, although yes, okay, they don't end with logy, are still going to be yes, okay, medical specialties. Okay, where here is going to be yes, okay, a psychiatrist. If you say okay, pediatrician, geriatrician, geriatrician, and bariatrician. Did you guys get that?
I just have a question.
Yo.
So is iatric the same as logi? Like it means to know? In that sense?
If you want to put it that way, yeah.
Okay.
Okay. Okay, guys. Any questions about OMA? Clear? Okay, so once it ends with OMA, either tumor or mass. Clear? Okay. If we put carcin in front of the OMA, there's no question about that. It's going to be a cancerous mass or a cancerous tumor. Clear? Okay. If we put sarcoma or sarc in front of the OMA, no question about it. It was going to be as okay a cancerous tumor, but here either is okay involved in muscles, or it's okay the 4 out of the 5 connective tissues that we mentioned yesterday. Okay. Osteosarcoma, chondrosarcoma, liposarcoma, and fibrosarcoma. So all those were cancerous tumors of the bone, cartilage, fat, and fibrous tissue. Yes.
I was just, so what areas of the body do carcinomas happen?
No, my dear, usually when we say carcinoma, it can be as okay other tissues but your connective tissues. Right. For instance, okay, if you heard of now breast cancer is a vast term, or it's a big umbrella term because there is going to be sub classifications of that. Okay. Okay. So you can say it's okay if you, for instance, have an adenocarcinoma in the breast. You gotta think about okay, what glands do we have in the breast? That would be a mammary gland. Did that make sense? Okay. Okay. You will also see as okay, all there's okay, not necessarily as okay, there's something that they call as okay, ductal carcinoma. So okay, as okay, those ducts that carries the milk from the breast, okay, from the mammary gland to the nipple, can also get cancerous. So you, in that case, that's okay, it's going to be carcinoma. Okay. Some skin cancers, we actually has had what we call as carcinoma in situ. Now, some of you are going to say, what the is an in situ? We can always talk about that when we get to talk about skin. Okay, but that actually is going to be a membrane in your skin, which we also also may call as the basal membrane. So if that becomes if your cancer is derives from that, that's what you can either call a basal membrane carcinoma, or you can say carcinoma in situ. Yeah, okay. So usually that's when it has develops in things such as inner lining or outer linings, it will be carcinoma of most of your body structures. Okay. Whereas as if it develops in things such as muscles within the body structure, it will be as a sarcoma. Even if it develops in as any form of as connective tissue within a structure, it will be a sarcoma if it's cancerous. If not, then it will be oma. But then we also had omas which had no carcin written with them, no sarc written with them, but they were still cancerous. Clear? Okay. And the example was hepatoma. Hepatoma, right? Okay. Which made us would be as what we will call as would be the word for oopsie mopsy liver cancer, known as hepatoma. Now here there's no carcin, there's no sarc in the word. Okay, guys, this fellow here is may also be called hepato from liver, cellular, that's as pertaining to the cells, and as here you will see. If you definitely wanted to, yes, have the word carcinoma and specifying that it is cancerous, yes. But all these three words is just three words for yes, the very same thing. So liver cancer can also be called hepatoma, can also be called hepatocellular carcinoma. Yeah, okay. Another one. Lymphoma. Okay. Now here's oma is still, this is still going to be cancerous. Here is lymph. Now all is lymph is going to be a fluid, but there's going to be something that we will call lymph nodes. So cancer is developing in the lymph nodes will be as lymphoma, roughly speaking. Okay. Another one is melanoma. This is still cancer, or still cancerous of as your pigment cells. So maybe it's okay, what people commonly as okay will call skin cancer, but as I just said earlier, it's okay. We also have okay, what you call carcinoma in situ or basal membrane carcinoma, which was not involving the pigment cells. So melanoma is mean it's okay, what you can call a molar cancer. It may look like a regular mole, but it's okay with a closer look. That mole is not that innocent. And okay, as what I said the other day was a hell of a word. Oopsie, sorry. Mesothelioma. Okay. Right. But here is okay, the word mass, MES. Okay, MES mainly as okay, or as okay, B membrane. Okay. Now, okay, don't go into detail, but it's okay. This is still going to be it's okay a cancer. There's going to be it's okay a cancer of your it's okay what they call the pleural membrane, a membrane that covers the lung. So mesothelioma maybe it's okay what on a broader spectrum as okay, a broad root is okay, may just have been classified as a lung cancer, but it's not the lung that is involved; it's the membrane that surrounds the lung that becomes cancerous. Have you guys ever seen those shows where they demolish houses? Flip flop?
Yes.
And when they find that, okay, as the asbestos, why do they have to dress up as astronauts to demolish that house? Because one of the main reasons for yes, okay, mesothelioma is asbestos. They used to use that in building material and shipping and all that. Oh, yes, okay, now if you have to be any closer, yes, okay, you will have to dress up like an astronaut. Because it's, yes, okay. It's a carcinogen, right? And this fellow here is okay, is super malignant, super cancerous. And then we have some omas which had nothing to do with cancers or tumors, but it was just collections or mass. Clear. The favorite one, hematoma. Okay. Bruce. Any words of wisdom? Yep. Nobody want to say anything? Okay. Now, just to make sure that you guys don't get hypoglycemic, take your break and get something to eat. And if you can't eat, then read. If you can't read or eat, then do something else. But I will see you guys back at, should we say one, no, sorry, not one, sorry. Let's say it's okay, 12:50. Is that a fair deal?
Yes. Also, did you get, I'm sorry, did you get my email about me losing power or no?
Well, my dear, I haven't been checking my email, so
Okay, no, I was just asking. All right,
that's
thank you.
fine, my dear. No problem, dear. Anybody have any questions to ask? OPSI. Strange enough, it's okay. To view. Okay. Now, as far as the suffix OPSI is concerned, we mean it's okay, it's going to be talking about two words. One is going to be it's okay what we call biopsy. Okay. Now, guys, it mainly is okay came from bio and then opsy. Okay. What the media okay just did was that they merged. Oh, right, okay, it's my head. Cross this one out or this one. Otherwise, it's okay, the verb had become biopsy. Okay, and that's a Britney Spears song. Okay, so but it's mainly going to be it's okay to view something that is living. Now, usually, guys, it's okay when we talk about a biopsy, we can mean it's okay, that's going to be as okay. Checking on a specimen. It's okay. That we get or got from a living person. Okay. That specimen is going to be called a biopsy if the person was alive. So what would be examples of a biopsy? Whenever you go to Quest, LabCorp, or whatever blood lab, and you give a blood specimen. Now, hopefully it's okay, you were alive at that time, you're still alive, so that blood specimen will become a blood biopsy. Okay? You pee in a cup for that to be tested. That PP is going to be a biopsy. Okay? They operate on you, yes, okay, take a specimen of a whatever. That becomes a biopsy. Or that becomes a specimen. Or if they check on that, that's going to say it's okay, then you call a specimen a biopsy. And the report as a result of that is going to be a biopsy report. But that's because it was taken from a person who was or is alive at the time when the specimen was taken. Did that make any sense? Okay, so it mainly came from bio, which is alive, opposite to view. Okay, pretty much okay, as we would say here, that is going to be as okay a biopsy specimen. Or even as okay if you went for a nasal swab during COVID. you were alive at that time, hope was okay, and thanks God you still are. So that would be a biopsy. Okay, so the other option that we're going to be talking about is going to be, yes, okay. Autopsy. Now again, yes, okay here. It is still going to be yes, okay, opsy. Where we can say it's okay that the word out, or actually it's okay, auto. Literally, yes, okay, the word out would mean self. Just think of the word automatic. Sorry. Right, okay. When you say automatic, what does it mean? Something that happens on its own or by itself, right? Okay, I didn't do it. It just happened automatically, right? Okay.
Wait, it's by like autopsy, like a exam of a dead body because it happened. It just
There you go.
happened. Huh?
Okay. Yeah.
Okay,
So
thank you.
in this case, yes, okay, what is that autopsy is going to be? Well, okay, you're going to say it's okay. Examining of a specimen from a dead person. Right, okay. CSI, special unit and all that. Okay. They find a dead body in, okay, that's whatever place. And they want to know, that's okay. Is there anybody who was behind the crime? Was there any other crime yes, okay, involved? Okay. That's going to, yes, okay, be determined based on an autopsy report. Okay, where they mean is okay, now the person is dead. Well, okay, they just get different specimens from that. Okay, they may find some traces from somebody else. Okay, and then they're going to yes, okay, go and look. Okay, yes, and we find the person from where other yes, okay, those other tissues or specimens yes, okay, to whom yes, okay, they belong. So yes, okay, they may come and knock on somebody's door and say, well, okay, yes, did you know so and so and so and so? Yes, okay. Okay, we would like you to yes, okay, come and give off, okay, as a specimen of whatsoever. Yeah, okay. Now that specimen taken from the person is okay, whose door they knocked upon, that's okay, is going to be a biopsy because okay, he or she probably is okay, is still alive. May not remain alive for long because okay, they may get punished. What they were involved in. Okay. Did that make sense? So the difference here is okay, whether it's from a person who was alive or whether it was from a person who was dead. Okay. So yes, okay. CSI, that's why you'll see yes, okay, that the autopsy report says so and so and so. FBI files, the autopsy report says so and so. Okay. And what they may find in the autopsy is okay report is okay as something that okay is need to be is okay confirmed with a biopsy from okay as a possible culprit. Any questions? So everybody is clear about the two opsies? Okay. Good. Now, oses of Moses supposes histoses of roses. Yeah, okay. Now here we can say yes, okay. S is okay, B is okay, condition or state, or what the word or what the letter O will mean is OO. And if something is OO, that's okay, that's going to be abnormal. Clear? Okay. Now we can take, okay, yes, a couple of terms. Let me just go to the next page. Now there's something that is going to be called necrosis. Okay, now please, okay, here's okay. This is the C as in cat. Not as your book says, FR or PH, sorry. That would then become as okay, something related to kidney. But here, necrosis. So that's okay. The osis here is an abnormal state or condition. Okay, and what is a necrosis will be? Oh, yes, okay, the word neck or actually is okay means death. Right? Now, usually it's okay, we may not use the word necrosis as such, but if anybody ever heard of gangrene, gangrene is mainly as okay, just an example of necrosis. Okay, where the main is okay is going to be, you can say it's okay, death of tissue. Is that clear? So maybe it's okay, a state in which it's okay, the tissues start to die. That's what you call necrosis. A common example of that can also be referred to as gangrene. Did you guys get that?
Does it still mean if you spell it NEPH, is it still the same meaning? Does it still mean
No,
death?
then it would be nephrosis. Then it would be an abnormal state or condition or disease state of the kidney, right?
Oh, right.
If you look in your book, my dear, it says nephrosis, right?
Mm-hmm.
Okay. But what I just did here was I changed the PH out with C. And now all of a sudden it means something completely different.
Gotcha.
Now, the reason that I direct your attention towards that is not just you guys, anybody, and you and me in some cases, that we just tend to read the first 2-3 letters and the last 3-4 letters, and just may tend to just okay, fill up the spaces by ourselves. It's not because somebody is dyslexic or so and so. It's just okay, I guess, something in the human psyche. Yeah, okay, so my point here was, okay, please make sure that, okay, yes, you read the whole word and not just the beginning 2-3 letters and the last 3-4 letters. Because, okay, if it was a PH rather than a C, then, okay, yes, there's a hell of a difference between nephrosis and necrosis. Okay, so when we said nephrosis, that was going to be as okay, disease condition of the kidney. Whereas necrosis is going to be as okay, death of tissue. Did you get that, Dr. Asma?
Yes.
Good.
Thank you.
No problem, my dear. If you want to talk nephrosis, well, we can say it's okay, or look at here, it's going to be, it's okay, just nephr. Okay, yes, which was your kidney. And then yes, okay, the oocyst was going to be as okay and abnormal state or condition. Okay, so yes, okay, maybe yes, okay, just a broad term for okay, kidney disease. Okay, or disease process or disease of the kidney. You could have different examples of that. I yesterday mentioned. Hydronephrosis is just a type of nephrosis, right? That means that's okay. Why do we call it hydro? Because of the accumulation of fluid in the kidneys, which is not normal. Yeah, okay. Another word we still will end with nephrosis. Nephrosis. It still ends with nephrosis. But yes, okay, it's glomerular nephrosis. So you can see as okay, the term nephrosis means okay, just is okay as a bigger term that means okay, just indicates something wrong with the kidney. Okay, the reason that we call this one here is okay, glomerular nephrosis means okay because the problem lies here in what we call the glomerulus. Now, what the blue that is, we'll talk more about that when we get to the kidney. But that's going to be okay, where the problem lies, which cause a form of nephrosis, which specifically can be referred to as glomerulonephrosis. Did you guys get that? Now, how many of you are CVT students? A whole bunch. Now, guys, even though you are DMS, you will still have to be able to scan blood vessels. So if everything goes well, once you're done with me, most likely it's okay, you will continue into what we can call as okay, vascular scanning as the group that you are. After that, that's okay, your paths may split. So DMS will go on and do their own business. And okay, CVT and so on. So yes, okay, you guys will be doing your own business. Yeah, okay. And okay, guys, now the two words that I'm going to just okay give you. Now at the first, and that's again what I say is okay, at the first sight, they may look alike. And one is going to be let me just sorry. Is going to be arteriosclerosis. Yeah, guy, here the word artery is just derived from the word artery. O as in orange, is our combining vowel. Our oosis just indicate that, okay, this here is an abnormal condition. Or this whole word here is an abnormal condition. Where the word scler, S-C-L-E-R, means hardening. Is that clear? So arteriosclerosis, A-R-T-E-R-I-O-S-C-L-E-R-O-S-I-S. Arteriosclerosis is going to be as, okay, it's an abnormal state in which the arteries hardens. Or we can say it's, okay, they lose its elasticity. So what happens is the arteries, rather than being as, okay, able to go like this, pulsate, or be flexible, becomes rigid, becomes hard. Clear? Okay. Now, what causes this? We're still idiots. You can say, it's okay, maybe a little bit is okay related to age related. But yes, okay. Then it's still the question, why does somebody get it more than others? We still don't know. Okay, but what mainly happens in, yes, okay, arteriosclerosis, A-R-T-E-R-I-O-S-C-L-E-R-O-S-I-S, is that it's generally, yes, okay, just that there's going to be a phenomenon or a state in which the blood arteries hardens, become rigid. And the complication of this is a rise in blood pressure. Well, this itself may cause a rise in blood pressure. But if the blood pressure rises very high, that heart blood vessel may pop. If that makes sense. So you may, as okay, have heard of somebody who went to the doctor for a checkup, and the doctor sent him or her directly to the hospital because you shouldn't be roaming around with this blood pressure here. It's too high. You actually, it's okay, may end up with, okay, yes, in worst case scenario, most likely it's okay, they may well end up with a stroke, hemorrhagic stroke. Okay, so but that was also, okay, as arteriosclerosis. Did you guys get that? Yes, my dear?
Would would it be the same thing to say like it can lead to an aneurysm, or is that different?
No, aneurysm is something completely different there.
Okay.
We can always talk aneurysms at a later point there. Okay.
I don't know if this is a dumb question, but
No,
so is it
go ahead there.
is it that anyone who has high blood pressure has arteriosclerosis, or not necessarily? It could just be that, I don't know.
No,
'Cause
okay.
you said it's a
Okay.
complication of high blood pressure is a complication from arteriosclerosis, correct?
Let us put it this way. Okay, Asma, listen. You can say that everybody with arteriosclerosis, let me put it this way. Everybody with arteriosclerosis most likely will have a high blood pressure. But not everybody with high blood pressure necessarily have arteriosclerosis.
Got it.
Okay. But to be honest, 99% of the people with high blood pressure mainly as okay has a high blood pressure due to arteriosclerosis. But it's not going to be everybody with a high blood pressure who necessarily will have arteriosclerosis.
Okay, thank you.
No problem there. Now, what's the other word that occurs, as I said? Now, when I write it, it's going to just, okay, the first side is going to look just like the word about. Where we can say it's okay, the osis is still the osis. Abnormal state or condition. Scler here still means hardening. We can say yes, okay, that here is okay, Mr. O is our combining vowel, or vowel, sorry. Whereas ether, A-T-H-E-R. Now this word ether here, actually, that's okay, it comes from the Greek word. Athiroma. And if you look at the word oma here, it's okay, there's something that smells like mass, right? Right? So what in the blue is it that this ether here is? Called athiroma. It is going to be, it's okay, a mass of the ether. And that's going to be fatty. Did you guys get that?
So, ather means fatty?
Exactly.
Okay, thank you.
Okay. So what is going to be, it's okay, the definition of an athiroma? That's going to be, it's okay, we can say the accumulation of, I may make it a little colorful, fatty, as I do this way here, plaques. And where is it that these fatty plaques here is okay, will accumulate in the blood vessels. Yeah, okay. Now, just to be honest, guys, what the result, an outcome of, okay, the accumulation of those fatty plaques in the blood vessels is going to be is that blood vessel or those blood vessels are also going to get hardened or rigid. That's why I still have the term scler in it. Okay, what's going to be the outcome of that? Still high blood pressure. Or pretty much, okay, due to the hardening of the blood vessel. But what was the cause of the hardening of the blood vessel in this case here? That accumulation of the fatty masses in the vessel wall. So if you heard of somebody who have high blood pressure and may take, yes, okay, cholesterol lowering medication, one of the reasons could be this: to prevent atherosclerosis. That fat in the blood actually accumulates inside the vessel wall and cause it to become hardened. Did that make sense? Good. Now, ladies and the gentlemen, besides that, it may sound strange, but it's okay, we get clever, maybe not by the day by day, but maybe after years and years and years. A lot of chronic infections and so on, so on. So mainly it's okay, just the way that the body fights infection may also lead to, yes, okay, atherosclerosis. So what we actually is okay, we talk about is okay when we talk about blood primarily. There's going to be, okay, some cleaning cells that clean up the mess after an infection, after a war scene between any foreign substance that has entered your body and your body's immune system. Now, those cleaner cells may tend to turn into, yes, okay, what some people call foam cells and become fatty and accumulate in the vessel wall and cause atherosclerosis. But otherwise, that's okay, we can make it okay, those fatty plaques in accumulation of those fatty plaques in the blood vessel is what you call atherosclerosis. So in both instances, okay, there's going to be loss of flexibility of the blood vessels, which will eventually lead to high blood pressure. And why do I say it's okay to pay close attention? Because guys, back in 1997, yep, that was when I was as a student of 4th year in medicine and studying pathology. And 2 terms that we had, written right next to one another in our book of pathology was arteriosclerosis and atherosclerosis. So that's why I say it's okay. Please make sure that as you look at the whole word. Because for 15, 20 minutes, that's okay. I was confused myself. What? Because in one case they said, okay, it's just this, and in another case it's like, okay, but it's the same word. No, it wasn't. Okay, it wasn't. When I took a closer look at it, that's okay. One has ARTREIO, sclerosis. The other one was ATHERIO, sclerosis. Okay, so it's not just okay. You guys, it happens for anybody, and I said, okay, why it's okay? Maybe there's something in the human psyche that we just tend to read the first part and we skip the middle. We just think it's going to be automatic. Okay, so the outcome of both of them is the same. Less flexible arteries, rise in blood pressure. For one, we know it's okay a lot. For one of them, we don't really know what causes it. Is it age? Is it bad hormones? Is it bad lifestyle? Is it environment? Is it diet? Is it what the? Okay. So, any questions? But both of them were OCs. What kind of OCs? Scleroses. Okay. Any questions? Nope. Did I make myself clear? Good, good, good. So arteriosclerosis and atherosclerosis. And here you see another OMA, right? Well, it's okay when this does go to mass. Mass made of what? A fatty mass. Right. Well, ladies and gentlemen, this is the standard definition of arteriosclerosis. The accumulation of fatty plaques in the blood vessel walls. Most likely, yes, okay, these blood vessels, yes, okay, still will be. That's okay, what we call the arteries.
How do you spell the eight? Oh, sorry. The OMA, the ATH OMA one.
It's just ATHERMOMA.
Thank you. And that's just like a fatty mass.
Fatty mass. That's pretty much what it means. But where this word, where the OMA would just be mass, and ather would be fatty. So a big chunk of good butter. Okay, guys. Any questions between scope versus scopy? These guys, scope, the tool, or we can say it's okay, the instrument. Where scope is using the tool or instrument, right? Okay. Did you guys get that?
Mm-hmm.
Goody, buddy. Now, what can, that's just okay, let's go with the scopes. Okay, we can see what will we have. There's going to be, okay, what we may call oh, cranioscope. Now, this is your combining vowel. The word crani has nothing to do with cranes. It's mainly, okay, just the word for skull. Did you guys get that? Well, let's do it this way, yes. Okay. For scopy, yes, okay, we can say this. Scopy. And we may say tool. Well, let's do it this way. So you can say scope, the scopy versus Toby. Okay, so whichever we use, we can say yes, okay. Crani or scope or scopy. Where the word crani means skull. Yeah, okay. So what would a cranioscope be? At viewing in yes, okay, a visualizing tool or instrument that they poke through the skull to either, yes, okay, examine or do surgeries on the brain. Nowadays, that's okay, that's common. But before we had scopes, what would they do if they had to do surgery on the brain or inside the skull?
Drill?
Or they still drill, but
Oh.
then that would be called a craniotomy, right?
Oh. Yeah, that's true.
Okay. Now, guys, when we say craniotomy, it's okay, what they would still would do, still is okay, long live Home Depot. Okay, as some of those hand-driven drills, but that's okay, make multiple holes, saw between the holes, remove the bone, and they had the area of operation right in front of them. So what do they do afterwards? Put the bone back. It may sound strange, but that's okay, you may apply a couple of sutures